The American healthcare system, often praised for its medical advancements, faces complex issues that affect its ability to provide comprehensive and fair care for its growing population. This Photo Voice documentary will explore the challenges within the healthcare infrastructure, examining the obstacles preventing effective healthcare delivery. The first place to look when examining America's healthcare infrastructure are the issues within the system, which there are many. The first topic I would like to explore in healthcare is its fragmentation and lack of coordination. The American healthcare system is like a mosaic of public and private entities, each one often working independently. The lack of smooth coordination and sharing of information among healthcare providers creates difficulties in providing continuous patient care. According to an article found on mathematica.org, a public health research and data analytics consultancy, fragmented care occurs when a patient sees many different providers and does not see a single provider for a substantial portion of their visits. High levels of care fragmentation can lead to poor communication and coordination among providers and is associated with increased hospital and emergency department use, unnecessary testing, and increased medical costs. Another ongoing issue in America's healthcare infrastructure is its access disparities. There are noticeable differences in how people can access healthcare, with some communities facing more obstacles than others. Limited insurance coverage, issues with transportation, and living in remote areas contribute to uneven access to essential healthcare services. This inequality can lead to delays in seeking medical help and worsen existing health disparities. According to the CDC, rural Americans are more likely to die from heart disease, cancer, unintentional injury, chronic and lower respiratory disease, and stroke than their urban counterparts. Additionally, children in rural areas also face challenges. A recent CDC study finds that children in rural areas with mental, behavioral, and developmental disorders face more community and family challenges than children in urban areas with the same disorders. Despite efforts to make healthcare more affordable through the Affordable Care Act, a considerable number of people still don't have insurance. High deductibles and copayments are a part of why individuals hesitate to seek prompt medical attention, resulting in late diagnoses and treatment, impacting the health of the individual. In 2022, 26 million people, or 7.9% of the population, were uninsured, according to a report in September 2023 from the American Census Bureau. It is of no surprise that the shortage of healthcare professionals is a contributing factor to the issues of the American healthcare infrastructure. The shortage of professionals, such as physicians, nurses, healthcare educators, and midwives, make it difficult for communities to access essential primary care services and specialized treatments. According to the AAMC data, the United States faces a projected physician shortage of up to 124,000 physicians by 2034, with demand for physicians outpacing supply. The nation's demographics, particularly population growth and aging, serve as the primary driver of increasing demand for physician services. Having explored key issues within the American healthcare system, let's turn our attention to the barriers that affect care and exacerbate the challenges faced by both healthcare providers and the public. High healthcare costs, including medications, are major barriers, especially for those without insurance or facing significant out-of-pocket expenses. These financial challenges limit access to necessary medical intervention. Unequal distribution of healthcare facilities, particularly in rural areas, creates geographical barriers. Transportation challenges further impede individuals from accessing necessary healthcare services. Cultural insensitivity and language barriers hinder effective communication between healthcare providers and patients. This barrier contributes to misunderstandings and prevent the development of trust in healthcare interactions. Limited health literacy among certain populations affects the understanding of medical conditions and treatment plans. These barriers stop individuals from making informed and proactive healthcare decisions, leading to suboptimal health outcomes. The impact of inadequacies within the American healthcare infrastructure include limited access and resources, resulting in delayed diagnoses, leading to the start of treatment at a more advanced and costly stage of the disease. Delayed treatment impacts patient outcomes and contributes to increased healthcare costs. Higher morbidity and mortality rates, particularly in vulnerable populations, are known to have been due to inadequate healthcare infrastructure. Untreated or poorly managed health conditions contribute to adverse health outcomes. The economic burden increases due to higher healthcare costs and low productivity resulting from inadequate healthcare. The downstream impact of untreated health issues affects the workforce. As stated by the U.S. Department of Health and Human Services, poor health generates costs for employers, such as greater healthcare expenses and a higher rates of disability, absences for illnesses and medical appointments, and working while sick, all generate indirect costs that reduce workforce productivity and contribute to the declines in labor force participation, further amplifying economic challenges. Inadequate healthcare infrastructure worsens existing health inequalities, disproportionately affecting marginalized communities. Limited access to resources perpetuate a cycle of health disparities and slows the progress towards health equity. Having identified a few of the many barriers, let us shift our focus towards potential solutions that may provide an accessible healthcare system. Universal healthcare coverage by implementing policies aimed at ensuring all individuals have access to essential healthcare services. Workforce development through initiatives to address shortages of healthcare professionals, including physicians, nurses, and allied health workers. Incentivize healthcare professionals to work in underserved areas and improve access to care. Invest in modern health technology and information systems with enhanced interoperability for those who struggle with the use of technology, like the elderly or visually impaired. Lastly, focusing on preventative care by shifting the healthcare paradigm towards a stronger emphasis on preventative measures. Launch public health campaigns to promote healthier lifestyles and early detection of medical conditions. The challenges within the American healthcare infrastructure are extensive, multifaceted, and require a collaborative approach for any kind of reform or improvement. These issues range from systemic problems, barriers in care, to the inadequacies of resources. Addressing these challenges is no easy feat and demands sustained efforts and a commitment to creating a resilient, accessible, and equitable healthcare system for all. It is through such initiatives that the nation can overcome hurdles and find a path towards improved health outcomes and a more just healthcare landscape.